This is Dr. Jamie Koufman, and this is Dr. Koufman's Acid Reflux Hour. Today, I think, is one of the most important topics that I could cover, which is essentially respiratory reflux in medical misdiagnoses. If you think about it, I changed the term LPR to respiratory reflux many years ago when I realized I was seeing patients with ear problems, with sinus problems, with shortness of breath, and with pseudo-asthma. And I recognized that the term, 1987, laryngopharyngeal reflux, LPR, I came up with the term because I didn't want to say GERD, because my patients didn't have heartburn, indigestion, and esophageal disease. You might ask yourself, how can you have respiratory reflux without having esophageal problems? And the answer is that the esophagus is robust. You can have 50 reflux episodes a day, and it's still going to handle it, it's still normal. But one reflux episode a day or 3 a week can wreak havoc in the respiratory system. So remember, the respiratory system are the ears, nose, throat, sinuses, breathing passages, voice box, trachea, bronchi, and lungs. And it's very important. I should tell you, I'm shocked. I've done a prospective study. It's almost complete. I'm waiting for 100 subjects, but I've been doing prospective study of people I've done consultations with over the course of the last couple of months. And to my surprise, 46% had shortness of breath. And there are a lot of questions this week about shortness of breath. So I'd like to talk about that just for a moment before I talk about the 5 specific diagnoses I'm going to talk about. Shortness of breath comes in 3 varieties commonly. The first is shortness of breath on exertion. For people who have respiratory reflux, the pulmonary function test will be normal, the chest x-ray will be normal, and yet they'll have exercise-induced shortness of breath. Particularly long-distance runners will experience it the first half hour, and then it'll settle down. The second type is airway obstruction, meaning trouble getting air in or out. A classic example of that are choking episodes like laryngospasm and things that are caused by reflux and asthma. Now, in this study, we've looked at people who said asthma was one of their diagnoses, and the only question I asked was, when you have an asthma attack, do you have more trouble getting air in or out? And they said in. So 4 to 5 people out there, all of you, listen, if you have asthma and you have trouble breathing in, you don't have asthma. The medicines don't help very much, do they? Maybe the inhaler a little bit. So you don't have asthma, you shouldn't be on asthma treatment if you have reflux. Trouble getting air out of the lung, that's asthma. So the first really, really big misdiagnosis is asthma. And I'll get more about that in a second. But I want to talk about the third. I hope when I'm gone, they'll call it Jamie's sign or Koufman's sign, because nobody's ever said anything or written about it before. But when I'm asking, so I asked, do you have shortness of breath on exertion, airway problems? And the third one is quite specific. Do you have trouble taking a full breath in or difficulty taking a full breath in? And to my shock, 70% of people with shortness of breath complain of that symptom with respiratory reflux. I mean, more than the other 2. So 70% of people with shortness of breath said they had difficulty taking a full breath in. Now, if you have that, I want to say that that's pathognomonic for respiratory reflux. The word pathognomonic is a wonderful medical term, which means if you have this, that's the diagnosis. There aren't any other ones. So, in my opinion, difficulty taking a full breath in, if you have that, you have respiratory reflux. If you've been on treatment, and you've taken famotidine and all that, and you still have that symptom, you still have reflux. So, without further ado, I want to talk about asthma a little more. We spend $80 billion a year on treating asthma. It comes out about 2,500 per person. It's 31 million of you with a diagnosis of asthma. And what I'm saying is 4 to 5 of you don't have asthma. You ought to not be able to graduate medical school without knowing trouble breathing in is never asthma. Trouble breathing out is asthma. The bronchial tubes get constricted and swollen, and it's difficulty to squeeze air out of the lung during exhalation. Ironically, even people who have true asthma, that's true asthma. A study by a colleague in Birmingham, Alabama, showed that 77% of asthma attacks were triggered by reflux events, respiratory reflux events. So respiratory reflux rules the day. Most of you have asthma, don't have asthma. And like I said, you shouldn't be able to graduate medical school without knowing that in isn't asthma, out only is asthma. And that's shocking to me that pulmonologists don't know that. I mean, I don't see how you could get into that field without knowing that particular fact. So if we were to make a proper diagnosis of asthma, we would save $55 billion, and people would get better care because they would be then being treated or at least recognized for the presumed diagnosis of respiratory reflux. So asthma is the most obvious misdiagnosis. I mean, really, 80% of you who have diagnosis of asthma don't have asthma. That's a biggie. The second one, believe it or not, is allergy. And I was shocked. We spend $43 billion on treatment of allergy, but only $18 billion on inhalants and seasonal allergies. Now, let's talk about that for a moment. That can be misdiagnosed and reflects the real diagnosis as well. Here's how. If you have inhalant allergies, usually it's in contact with an offending pollen or whatever. I have a problem with ragweed. My nose runs, I sneeze, my eyes get itchy, and it happens acutely when I play the 14th hole along the river in the fall. There's a lot of ragweed. So all those accompanying symptoms. Meanwhile, the mucus is always thin. It doesn't get on the vocal cords, and you don't have to hawk it off. So if you have thick mucus and not a bunch of prevailing other allergy-type symptoms, thick mucus is reflux. After all, respiratory reflux, the lining membrane of the respiratory system are mucous membranes, and guess what they do when irritated? They make more mucus. So thick mucus is generally respiratory reflux. Some of you have asked about that. That cat is a well-known cat named the Dude, and he's an extraordinary Siberian cat. Anyway, enough about that, but people have asked. The second part of this allergy really threw me for a loop when I looked at the number. So $43 billion is spent on allergy and $25 billion for food allergies. We don't know anything about food allergies. We know about some trigger foods for reflux. For example, alcohol, onions, chocolate can be trigger foods or common trigger foods. But food allergies, the thing that's wrong with this is that the technology, the science isn't there. So what they're doing is they're doing IgG clumping. We take your blood and this technology is useless. So in my opinion, this whole industry at this point, at least for in the majority of cases, is bogus. You're not, you get those things back and you're allergic to 40 things. That's not the way it works, and I don't believe it. So if you have food allergies and you're eliminating 40 things and you have IgG clumpy testing, there is one company that I know of in California that does actual antibody testing. It's expensive, I can't remember, but for a full panel it's over $1,000. But they actually have antibodies, and they can look at things like gluten. They'll look at gliadin, and but everywhere else it's a technology that I think is basically going to go away. Antibody testing is the way to go, and it's yet in its infancy. So anyway, the allergy question is I'm not very, very convinced about the food allergies, and some of you don't have typical inhalant ones. I want to talk next about sinusitis and nasal congestion. People get nasal congestion in the morning, and people have a fullness and pressure in the face. Those people, by the way, often also have ear symptoms, popping, fullness, even hearing loss, pain, and tinnitus. Reflux into the pharynx can go into the nasopharynx, which is the highest part. And right there's a puddling thing. If you look on please, all of you, use JamieKoufman.com as a resource. Read the article on ears and hearing loss. Read the article on sinuses. In any case, all of a sudden you end up in the ENT office, and the ENT gets a CT scan, or we used to get plain films, and you have mucoperiosteal thickening, which means all the lining and all the sinuses is thick. Unfortunately, the radiologist decides to call that chronic sinusitis, which then gives the surgeon an opportunity to do a surgical procedure, which is probably unnecessary. So mucoperiosteal thickening, meaning the lining on the bone of the mucous membrane is thick, is mucus. And I can tell you, the angriest patients that have seen me over the years are patients that have had multiple sinus surgeries, miserable experiences, and they come to me, and basically what they had all along was postnasal drip. And postnasal drip, too much mucus, a sensation of a lump in the throat, sometimes it's just the mucus, chronic throat clearing. These are 88% of people with respiratory reflux have these symptoms. So those are the number one symptoms of respiratory reflux. And these people have had multiple sinus surgeries. They're looking for a lawyer to sue these doctors. I calm them down and say, let's just fix your reflux, and that's what I try to do. So if you got a lot of surgery on your sinus and it's all about postnasal drip, think again, respiratory reflux. The first two I've talked about now, I think are real misdiagnoses. But the next two are much bigger because they're not a misdiagnosis like I went in, I had a bellyache, they see that it was a virus, they see no. These take 20 years or a lifetime to develop. So I'm going to quickly talk about COPD, chronic bronchitis, and again, I urge you to use my website. If you've not signed up for JamieKoufman.com, every week you'll get the notification if I do a blog. I'm slowing down during the summer now. I've just done one on respiratory reflux, acid reflux, and gut health, which is really an eye-opener for me, starting to learn about gut health. And I'll talk about that in a minute with the questions. But in any case, you'll find as a case, a man in his late 60s came to me, wheeling oxygen, could hardly make it from my waiting area into my exam room, terrible reflux. Meanwhile, he had quit smoking 25 years ago, and he had progressive COPD and was probably on his way to living 6 feet underground. So he was very, very good about his treatment. I mean, sleeping, sitting up, taking all the medicines, changing his diet. And guess what? His reflux went away. He stopped needing oxygen all the time. He went long periods without it. And he got in his car. I tell this story all the time. He got in his car and drove to Florida to see the Mets spring training. Changed his life. So if you have and by the way, 30% of people with COPD are non-smokers. So don't believe it. It's not about pollution. It's not about secondhand smoke. It's about respiratory reflux, which goes unrecognized. The common thread of all this is silent nocturnal respiratory reflux. So it's easy to miss because the GI doesn't know anything about that. If you have respiratory reflux, really, and go to a GI, you're not going to get, they don't have no diagnostic test or treatment for that. The go-to doctor doesn't know anything about respiratory reflux. So why would your ENT, why would your lung doctor? So again, big hole in the ozone layer is respiratory reflux. COPD, also chronic bronchitis. There's a lovely case that I refer to of a man who had terrible chronic bronchitis, coughing up blood, and he was seen at a very famous medical school in Boston and at a famous a respiratory hospital. I can't remember where it is. I think it's in the southeast. But anyway, he was flying back and forth from these two. He came to see me. I said, reflux. Treated his reflux differently. This guy's been coughing up blood for 2 years, miserable. I sent him to the surgeon, and I put him on the stuff, everything that I call a reflux detox. 6 weeks later, he was well. Let me say that again. after coughing up blood for 2 years, being seen at two of the best medical schools in the country, 6 weeks after his fundoplication, he was well. No coughing up blood. So when we talk about COPD and chronic bronchitis, you have to understand that these take a long time to develop. Excuse me. I'm dry. So this brings me to the point that any lung disease, remember, respiratory reflux is ubiquitous. You know, it's cultural. We eat late. There's a big refueling meal of the day. We have alcohol. We go to bed too soon. And reflux all night without knowing it. Although some of you wake up in the middle of the night coughing, that is reflux, not COPD. That's reflux, period. And you do that. So I think the message is that any lung disease can be either caused by, or worsened by, or really accelerated by respiratory reflux. And I've had a lot of cases over the course of my career where people had rapidly progressive disease that was dangerous, and when we got the reflux under control, we got a disease that was treatable in a normal fashion without having the patient die. So any lung disease, for example, I think if you have cystic fibrosis and reflux, the prognosis is much worse than cystic fibrosis alone. So now comes the biggest of the big, sleep apnea. And by the way, I have a problem. When I sit on this thing and I talk to you, my friends, my colleagues, my followers, my patients, my people in general who understand things aren't quite right. I mean, think about this question for a moment. Dropping Acid, which is clearly a book about reflux, has been the #1 bestseller in the category in asthma on Amazon for well more than a decade, which means people are figuring out that it's not asthma, it's reflux, but even though their doctors aren't. #1 in asthma on Amazon for more than a decade. Sleep apnea. When I was a kid, just so you know, we didn't have obesity. There was like 1 or 2 people that were really overweight. Didn't have an asthma epidemic, maybe 1 person that we knew. There was no such thing as sleep apnea. Some people snored. The disease didn't exist. It took 2 or 3 generations of we spend $1 trillion a year to get sick. 30% of the American diet is fast food, okay? And so all the things that cause reflux, year after year, month after month, decade after decade, and people get snoring and sleep apnea. If you go on my website and look at sleep apnea, you'll see there's a picture of a pharynx. Pharynx should be a nice round tube. I can examine somebody's throat and say, ooh, do you have sleep apnea? That's not right. That's right. Big, round. And so you can see long-standing inflammation, the folds of thickened mucosa. And so, in my opinion, respiratory reflux is the cause of sleep apnea, obstructive sleep apnea, for the vast majority of people diagnosed with that. And it takes many, many years to get it. And if you have sleep apnea, you ought to be sleeping on an incline. You ought to be taking famotidine and Gaviscon Advance and eating at 5 o'clock and doing everything that you know that you can find on my website. Again, jamiekoufman.com, K-O-U. I wrote that website for you. The stuff that I talk about today, there are articles, and they're all short. They're all about 800 words or so, 1,000 words maybe. So what I'm saying to you is that $150 billion is spent on an industry, and we've never addressed the elephant in the room, the American diet and lifestyle. $1 trillion a year to get diabetes and sleep apnea and obesity and cardiac disease. So we've never addressed that. Now, you can do something about it, and it takes work. You can turn most of those diseases around in the course of a year. a year of being, how should we say, like a monk or saint-like. So I don't want to talk much more about these except to say let me say that again, every single respiratory disease, nasal obstruction, get up in the morning, put alkaline water in your nose. Pepsin dies at pH 8, alkaline water, pH 9.5 or 10, it's great. And then these are little tricks. If you put alkaline water in your nose and it burns, you've got terrible reflux. It's just water. And the burning will go away when the pepsin goes away, as we think about it. So now I'd like to get to some questions, a lot of good questions today, and a lot of bad questions. So let me tell you what a bad question is. A bad question is when somebody asks, does this little thing fix my reflux? How come I took the famotidine and my reflux didn't go away? What about licorice? Okay, so none of these things are important. It takes a whole program, and the whole idea behind reflux is that you have to, remember, it's a vicious cycle, lower valve, stiff, swollen, inflamed, more reflux, esophagus gets lazy, upper valve kicks out. What do? Stop the reflux for, let's just say, 4 to 6 weeks, 100%, doing everything that is possible. Okay, read about intermittent fasting, read about the detox program, reflux detox. Just type them in on my blog and these articles will come up. Read about alkaline water and gum and famotidine and so on. So anyway, the first question is about famotidine. When using famotidine long-term, should be concerned with tachyphylaxis. Well, the idea is that we need treatment forever. What about the concept of making your reflux go away? Remember what I said, no reflux for a month, okay? And things will heal, even reflux. Valve gets nice and pink and works again, esophageal function. I did a consult with a 22-year-old woman who had dysmotility, esophageal, lazy esophagus, who was on terrible medicine. And I explained to her, reflux causes dysmotility, so get your reflux fixed. And you know, it's not the other way around. Ooh, this woman has this esophageal disease. In my experience, dysmotility absolutely goes away in 99% of cases. The ones that have achalasia, they present, and it's obvious that that's what they have at the outset. So all the rest of you are prokinetic agents like baclofen and more dangerous ones. Think twice because you probably have reflux that's not under control, and a pill's not going to do it. By the way, just so I can say this out loud, proton pump inhibitors like Nexium, Prilosec, omeprazole, pantoprazole cure 0% of people. So not a single person is cured by a PPI. You can make heartburn go away, you can make symptoms go away. And that's why long-term use of PPIs increases your risk of cancer, because it stops the symptom, but not the progression of disease. So anyway, getting back to famotidine. So the idea, tachyphylaxis means it doesn't work as well over time. In the old days, I used to change them after 2 years. I'd say take another H2 antagonist. But now, you ought to be tapering off it after 2 years and using it sort of ad hoc. Okay, I'm going out to a dinner a little late. I haven't had reflux. I don't want to have reflux. I'm going to take a famotidine before I go to bed. I'm taking out my Gaviscon Advance and sleep on an incline. I'm going to do everything I can do to prevent reflux that night. But remember, maybe this is important to say, you don't get reflux from one bad thing one night. There's usually, it has to be layered, where you know, a weekend of debauchery in New Orleans, followed by, a business meeting that went till 9:30, and then everyone out for a cocktail and a sandwich, followed by your family birthday, and it's a chocolate cake with chocolate frosting, and you love having it like whenever you can. So it goes on and on. And so it's usually not one event. And so this idea, people ask me like, well, how can I recommend things that are acidic? I had terrible reflux. I couldn't eat onions. I couldn't eat a lot of things, but I can eat them all now. The only thing I don't take is black pepper. Black pepper just makes me cough. And I don't know if that's vagal, certainly not reflux. But so even people who have trigger foods, often when reflux is gone, I don't mean 6 weeks later, I mean a year later, I can often eat foods that were not working for you when you had reflux. And some people, it's everybody. So, the alkaline water makes me reflux. Well, anything makes you reflux. esophageal function's poor, lower esophageal sphincter's poor. Now, so that gets me to the next question, is the impact of famotidine on the gut microbiome. Now, I don't want to spend the rest of my time talking about this, but I wrote an article, Respiratory Reflux, acid reflux in the gut microbiome. When I first started doing transnasal esophagoscopy, we were seeing Candida esophagitis, white plaquey stuff, and all the way up into the larynx and throat. You wipe out all your normal flora, at least on the top of the GI tract, and Candida takes over. So I wouldn't worry so much about famotidine, I'd worry about reflux. So reflux really changed, and not only that, the irony is the exact same triggers for reflux are the exact same triggers for a poor microbiome. If those of you don't know what the microbiome is, it turns out all the bacteria and fungi and viruses that live in your GI system turn out to be much, much more important. They have to do with what's digested and how it's digested and what's and there's hard evidence now. It's related to Parkinsonism. It's related to other neurological diseases. I made autoimmune diseases. So there is going to be someday, and we don't have it yet, you're going to have a little poop or a wipe with a Q-tip of your rectal area, and then we're going to look at the gut microbiome and then treat you specifically. There is right now for autism, anxiety and agitation, and for Parkinsonism, a specific Lactobacillus planarum PS128 by a company called Neuralide, which in animals, Parkinson models, has really makes it go away. And now there are clinical trials going on, and this is a no-brainer because the risk is so slow. The problem is $140 a month for that one. So that brings me to my last question about probiotics, which is if you have reflux, you should take a probiotic, and I have one that I recommend. A while back, more than a year back, a patient said that they were taking one that they recommended, that the reflux got better, the constipation got better. It's called Garden of Life. It's on Amazon. Garden of Life for men and women. They make one for prostate and all that. And so I recommended it to a few other people, and they really liked it. And then I started taking it myself and saw really nice benefits. I'm not going to talk about my GI symptoms. But so I recommend that one. It's not cheap, and the Neuralide is very expensive. So, but this is a field that's going to be evolving. So people ask me, does this affect the microbiome? Does this affect the microbiome? The answer is nobody knows, so certainly not me. So I'm going to finish with, I got a lot of good questions here, and I'll try to keep some of these for next week. I'm just going to answer this one quickly. What if famotidine and allogenates doesn't control certain things like asthma, cough symptoms? The answer is you've got terrible reflux, and taking those things are not nearly enough. You should be eating 7 hours before you go to bed. You should be, for a month, you should be basically on a strict low-acid, low-fat diet, nothing out of a bottle or can. I mean, all the things that I would recommend for someone who's in reflux trouble. If you're having breathing problems, you're in reflux trouble, respiratory reflux trouble. So taking the pill is not getting it done. So the last thing I'd like to, I got a lot of questions about this, and it's starting to distress me because I'm writing a book, and my editor says, when people read this chapter on the vagus, everybody's going to say, I have a problem with my vagus nerve. How do I treat my problem with my vagus nerve? How do I get my vagus nerve better? So let me just tell you what I know. About 40 years ago on Christmas, I got the flu, and I was sick as a dog. And a couple of days later, I lost my voice, and I paralyzed left vocal cord. I examined myself, and then I started to cough almost continuously, and I had reflux. All of them symptoms without heartburn. So before I got the virus, I never had a voice problem, I never had a cough problem, I never had a reflux problem. The vagus nerve is the most important nerve in the body. listen to this. It controls the respiratory system, the digestive system, the cardiovascular system, and most of your organs. One nerve. And it lives right in the lining membrane in the throat, right behind where the tonsils are. And viruses can hit it and injure it. And in my experience, we did a study, never published, about 40% normals, about 40% of the American population has had a vagal neuropathy at some time. Now, that could be the onset of your reflux. That could be the big thing, like it was in my case. But for most people, it's not. And even if you've had a vagal neuropathy, even if you have a weak vocal cord or vocal fold paresis, I still have vocal fold paresis, partial paralysis. It doesn't need treatment. So the answer to the question is, all you people are taking gabapentin and amitriptyline for reflux. The reflux needs to be fixed, and those medicines have no effect. And it's not a good idea for you to be on them. Personally, I treat 3 symptoms, neurogenic symptoms. Neurogenic cough, dry, never cough up anything during the day, triggered with changing temperature, diesel truck going by, perfume, not reflux symptoms, not coughing after you lie down. So I treat neurogenic cough, which, by the way, is uncommon. And then I treat voice use pain. I recently did a consultation with a woman who's a translator from Romania. By the way, I've done like 68 countries at this point with the consultations. If you're in trouble, Jenny Koufman has Koufman Consulting, but she was in trouble, and she didn't have reflux. So I talked about the treatment. If you go on my website and type in neurogenic, you're going to see the article. It talks about treatment. In fact, there's even a PDF that can be printed and brought to the doctor. This is not a treatment for reflux, period. And 99% of you, 98% of you, it's reflux. Okay, so 2% or less need treatment for something neurogenic, and in my opinion, it's overdone. Now, the vagus, just like silent reflux, is a great huge gap. You go to your doctor and say, I have and by the way, let's talk about throat burn. That's the third one. A woman came to see me from Kansas City, tiny thing, with terrible burning throat. I mean, not after meals, I mean like all the time. Terrible, miserable. Already had 3 operations. Had a fundoplication, had a lingual tonsil removed, and had something for Eagle syndrome removed. And she came to me, and I diagnosed her electromyography, and then put her on gabapentin, and as time passed, we escalated it. So I always tell this story because it's amazing. It's my last story. So anyway, I sent her home in July on 4,000 milligrams of gabapentin. They make a 100, a 300, a 600. I mean, it's a lot of different, obviously different ranges. So she comes back to see me in the fall, and she's happy. Burning throat gone, happy as a clam at high tide. I said, how much gabapentin are you taking? She said 8,000, and she was able to keep bullying her physician to give her more. And she finally, and that's the highest dose I've ever seen or heard of. But the point is, it's for neurogenic symptoms. Painful speaking, painful, not vocal fatigue, painful speaking, neurogenic cough, okay, and burning throat. That's it. So all you people with reflux and you have a sore throat, after in the morning when you get up, it's reflux. So without further comments about the vagus, I want to say that I have a lot of experience with the vagus. If you go to your doctor and you do have, let's just say, a neurogenic cough and need help getting prescriptions and so on, and they want to send you to a neurologist, go, You go to the neurologist and say, I have a vagal neuropathy and neurogenic cough, and go, huh? So, as with respiratory reflux, when push comes to shove, you're the doctor. So anyway, see you next month, and thank you. I think this one's a quite interesting talk.